Okay. So, yat everybody. Thank you all for coming and joining us on our first session of the PAWS Mental Health Webinar Series. My name is Tanya Tolino. Kiani Nishla Twedijni Ebashishchin Hatsoidashacheb Ani Dashinale. I am from Coyote Canyon, New Mexico, which is within proximity to Tohatchee, New Mexico. I am a fellow with the Johns Hopkins Center for Indigenous Health, and I have been here with the center since August of last year. I work with PAWS in addition to the teen pregnancy prevention team, and yeah, excited to start this first session of the webinar series with you all. And so kind of this get things going, I'll have the rest of the team members introduce themselves as well. So we can start with Shannon.
Hi, everyone. I hope you can hear me okay. My name is Shannon Archuleta. I'm a research associate with Johns Hopkins Center for Indigenous Health. I help to oversee several programs just with coordination and management, mostly randomized controlled trials. Very excited to be able to help with this webinar series and support this team in all of the wonderful work that they are doing with the center and for their community. Cody, I'll pass it over to you.
Cool, yeah. My name is Cody Elliott. My education is and I am a research program assistant with the Johns Hopkins Center for Indigenous Health too. I barely started, and so far it has been fun. I also work with the Project PAWS as well, doing a lot of the active service programs that we're doing, and this is one of them. So happy to be here. I'll pass it on to Christine. Christine.
Yad she Kristen Mitchell Yinishia Torachini Nishle Hanagani Bashichin my Deshkishin Dashe Auto Ki I Dashanelle. I'm from Chinle and I am a mental health program specialist with the center, and I've been with the center since 2018. Majority of my background areas in terms of work that I've done with the center includes suicide prevention intervention work, also maternal and child health work, youth mental health, and cancer care research. I just recently graduated into 2023 with my master's in clinical mental health counseling, on the road to licensure. So great to be here and joining my PAWS team here with this webinar series. So I'll go ahead and pass it to Tylea.
Hello, the echo. Hello, my name is Talia Town. Kiani Nishan Tetnizetni Bashichin, Nas Ejitohan Deshache Ashihan Deshanala. I am from Blue Gap, Arizona, but I live in Solani Cottonwood, Arizona. I joined as a research program assistant with Project A.W.A.R.E Wildcats, and I work alongside doing projects like doing webinars and just stuff like that. So I'm very excited for this first one. And yeah.
Yeah, great. So yeah, as you can see, we're all excited to be here. And you've been hearing this word called pause. So some of you may be like, you viewers may be watching and wondering like what exactly is it? So PAWS, it stands for Project A.W.A.R.E Wildcats, hence the acronym PAWS. And so this is essentially a project initiative under the Johns Hopkins Center for Indigenous Health. And it started out from a community needs assessment. Results from this assessment demonstrated that community interests and requests for programming revolving around mental health and wellness. Further, with collaboration with the Chinle Unified School District, IHS, and the Navajo Nation Dene Education Department. PAWS works to bring forth the programming for school-based mental health programs and services through the implementation of mental health-related promotion, awareness, prevention, intervention, and resilience activities, all in all to essentially make mental health care and wellness education more accessible for school-age youth and community members. And so to start things off a little further, we'll go into an agenda overview to kind of give you an idea of what to expect. So first off, we'll go over like housekeeping, kind of like general etiquette for Zoom, and just how to go about asking questions and like how to expect the length of the webinar to go. And next we'll go into considerations for transitioning to summer break, signs to look for when dealing with these transitions, strategies of support that can be offered or ideas that we can give you for navigating this, and some community resources within central agency and beyond. So housekeeping, as you can see, the webinar is going to be recorded. All mics are muted, and unless, otherwise told, and we'll be having a Q&A session at the end. And so please try to have your camera on when, if you can. And this session will be an hour long total with 15 minutes of Q&A at the end of the presentation. And these questions, if you have any, can be typed into the chat. So, our PAWS is excited to welcome Dr. Kiara Alvarez, and we are excited to bring her to you all to discuss the contents of today's presentation. Dr. Kiara Alvarez is a Bloomberg Assistant Professor of American Health and Adolescent Health in the Department of Health, Behavior, and Society. She is a health services researcher and a psychologist whose work focuses on mental health equity for adolescents and young adults. And Dr. Alvarez also holds a joint appointment in the Johns Hopkins University School of Medicine's Department of Psychiatry and Behavioral Health Services. And a lot of her research interests focus on the prevention of youth suicidal behavior, the mental health and well-being of Latinx and immigrant youth and their families, and the integration of behavioral health care across clinical and community settings serving youth. So without further ado, I'll give the mic over to Dr. Kiara Alvarez.
Thank you so much. Let me pull up my screen and get this shared. Perfect. Thank you so much for that wonderful introduction. I'm so happy to be here with all of you and get to talk about this topic today. As mentioned, I'm Kiara Alvarez, and I am from San Juan, Puerto Rico, currently residing and speaking to you from Baltimore, Maryland. And our focus today is really on talking about this transition that we're in, the summer state of mind that many of us are getting into as the school year winds down, gets to an end. And as we're thinking about this, exciting transition into summer break, it brings also some stresses with it, right? So something that we wanted to talk about today as families prepare for this transition. And we want to start with a little bit of a focus on what this transition is about. What are we transitioning out of, and what are we moving into for the summer? So a lot of the focus, in PAWS has really been on building up the resources and services available at school, because we know that schools are essential settings for youth mental wellness. And some of the things that are important for youth at school, even though sometimes they might not see it this way, right? We might be hearing kids talk about, not wanting to go to school again, doing the same thing every day. But that sense of routine is actually something so important, because it provides feelings of safety, provides a sense of control, and really provides comfort, during stressful times, to know that you're going to be doing the same kinds of things, that it's pretty predictable, that you know who you're going to see. And so that transition, into summer can come with a little bit of that loss of routine, and we'll talk about that in a few moments. But another reason why school is so important is because we get so many resources and support services for youth right there at school. So we know that at school, youth might have access to counselors, they have access to libraries for not only for books, but for other kinds of educational activities that take place during the school day. Youth may be able to access special education programs that provide them with important support, as well as community learning centers and other resources that are based in the school building. And lastly, we know that schools are such an important source of social connection. They're where youth are spending much of their time with their peers. They're also places where they build up relationships with other trusted adults outside of their family. And so those kinds of connections, that interaction with peers and practicing those, social skills day to day really supports social wellness, but also emotional and mental wellness. And so what we find is that transition to summer break, as exciting as it is, can also sometimes be challenging. And one of the challenges that we can see is that change in routine. I think for all of us, even changes in routine that are positive, right? Going on vacation or having something new going on that changes that day to day can cause some challenges. It can really cause, potentially a sense of being a little bit out of the norm. It can impact our sleep. So that change from waking up at a certain time, going to sleep at a certain time, to maybe sleeping later can cause some impact for youth. And in some cases, you might go through parts of the summer where there's no routine at all, really. There's nothing that's particularly expected of you. And that can be something that is actually a challenge for youth to adapt to. Another challenge is, we mentioned the importance of school services. It's that reduced access to school services. And so what if you have a child that is really benefiting from a particular service that's available at the school, whether something that is part of their day-to-day or something that they access occasionally? What if they're getting services to support their social emotional well-being, and now they don't have access to that over the summer? Another part that we don't always talk about is that there can really be some stress caused for youth, and also really for adults, right? Because of the stress about expectations about what the summer is going to be like versus the reality. And so we might have this expectation built up in our mind about how fun it's going to be, or all the things that we're going to do, or how much we're going to enjoy being out of school. And then faced with the reality that there might be some boredom, or some of those activities don't take place, sometimes we can feel a little bit of pressure, to live up to that ideal. And so that can cause some stress for kids. And then finally, the other one that we want to highlight is the fact that isolation from friends, can occur while you're at home. And so where at school, you just have this place where naturally you and your friends are there every day and interacting with each other, running into each other. In the summer, it takes a little bit more work. And so some kids, might be in a position where they're actually living close to their friends, or have friends, nearby, or maybe they have siblings that are close in age that they get along with. But for some, it might feel, there might be limited access to transportation to get to friends. They might be living at a long distance from other friends and peers. And in other cases, it just might require more effort to connect. And so that might be hard for younger kids, who are less independent, maybe don't have access to a phone or a way to reach their friends easily. But even for teens, teens that are shy, having to make that extra effort to get in contact with a friend or to make a plan with them can really feel somewhat stressful compared to during the school year. But that is to say, it's not, of course, not all negative, right? There's a lot of positives about summer break. Summer break can be an important break from those stresses of the school year. The school year can be intense. It can be tough for kids. And some kids might find school academic or social expectations very stressful. And so that can be a really nice change. If you've had a very stressful academic year, just like for adults, it's good to get a little bit of a break, to get some time off, to get to do other things. If kids are on the shy side, or they find that kind of constant interaction with lots of peers very stressful, or maybe behaviorally they have to work really hard on controlling their behaviors in a school setting, the summer can be a time for them to kind of get a little bit of some space from that, to relax. And part of the reason for mentioning that is to say that that's important, right? And we should give kids that opportunity to take breaks, to have time that's for themselves, or time that they can use in other ways, and not have to make, the summer be exactly like the school year in terms of routines. It can be very positive to have that extra unstructured time to explore interests and hobbies. And so when we're talking about the importance of routine here, it doesn't mean that you have to have every moment of your day planned or even, have every week have a plan and activity, because unstructured time can be a very good thing. It's a good thing for all of us to have some time that isn't planned, where we get to explore different ideas and interests, where we get to just let your mind wander or maybe have new experiences. So it's really about that balance between structured and unstructured time. Summer programs can be great opportunities to have new experiences. And I know at the end of this talk, we'll share some resources about summer programs. But the idea, being that summer programs, are different from the school year. You get to do new things, try out new activities, maybe meet new people or interact with people that you already know in new ways. And very importantly, summer is an important time to connect with your family, with your friends, and with your community. And so that might be something that kids can look forward to in summer break, and also something that families can really lean into during this time. And then, lastly, before we move on to more kind of details about what kinds of things may come up, it's important to acknowledge that summer break can be very challenging for parents and for caregivers also, right? So it's not only about the kids. Changes in routine impact parents and caregivers too. If you've got a nice routine set up where what time in the morning your kids are getting off, on the bus or getting dropped off at school, and then, when you're going to work or when you're taking care of other responsibilities, having that suddenly changed on you, having to figure out how to make that routine happen in the morning, having to adapt to new timing, that can really be a challenge. There's other things that you're keeping in mind. So that sort of mental checklist of what you might have to prepare for every week has changed. And it certainly can be a very stressful time. The school year, if you have to have a care for your kids, either because you work or you have other responsibilities to take care of, the school year gives you a sense of, what to expect when they're in school and when they're not, versus in the summer, you might have to be juggling to figure out even, week to week or even day to day what is going to happen and how you're going to make sure that your kids have that supervision that they need. So that can be very stressful, especially when you might have to get your kids into some sort of supervision while they want to maybe be at home or be doing other things. The balance for older youth is tough because I think, it is important to give them some freedom to let them enjoy the summer in that way, but they also still need some supervision and some sense of what they might be doing, where they are. And so finding that balance for your kids can be a challenge for parents. And supporting kids through transitions, which we'll definitely keep talking about, but thinking about transitions from the school year into summer activities, transitions into new programs and experiences could really be challenging for kids that struggle with change, especially, or kids that are maybe shy and need a little bit of time to warm up and to feel comfortable in a new place. That can put a lot on parents to be thinking about how to best support them. And lastly, I think in the same way we talked about kids' expectations versus reality, as parents, we can feel a lot of pressure to provide fun experiences. We have this idea about what their kids' summer is supposed to look like, but there might be challenges. Financially, it might not be possible to do some of the things you want to do. Time-wise, you may be having to do other things or other logistics, that can come up. Maybe, going on a vacation or going somewhere is not possible, for your family for various reasons. And you might feel some pressure around that. And so we mention all of this because, it's important to take care of your own well-being as a parent as well. And sometimes just being aware, why is it that I feel kind of stressed out about this time of year? Being aware of why that is and being aware that it can feel challenging even when you're doing things that are supposed to be fun. The same way that planning, to go on a vacation can be a challenge and be a stressor, even if it's something that you're enjoying doing and want to do. So, it's normal for kids to have some changes in mood and for things to go up and down, day to day, week to week. But some things, to be aware of that, are not necessarily negatives, but they're just things to kind of be aware of these changes day to day. One is boredom. A certain amount of boredom is a good thing because boredom can also lead us to try to come up with new things to do. It can lead you to be creative. It can lead you to take on, other new activities. And so, again, it's not about having everything planned out for kids. And we also know that it can be quite common, right, for kids to tell you that they're bored once, something has changed and they don't have something to do at that moment. So that in and of itself is not a problem, but if you're hearing a lot about boredom or hearing that nothing's enjoyable, then, you might be thinking about what other kinds of structure or routine might be important at this time. Another piece is increased screen time. It's going to be normal if kids are not in school or don't have those other constraints on their time that they might be using their phone more, they might be gaming more, watching TV, doing other things to fill up the time. And, just like anything else, we've got this question of, it's good to decompress and get to do some things that they don't get to do during the school year. And at the same time, you're wanting to watch out for that increase and more importantly, whether it's getting in the way of other things. Sleeping, we mentioned you might be looking at oversleeping, sleeping a lot more than usual, or lack of sleep. Kids that are having insomnia are waking up earlier than they intend to. And then certainly irritability, just this kind of sense, of being kind of uncomfortable, upset, frustrated. So, what do we do? What are some of the things to look out for more specifically? We want to think about the different needs of different ages of kids, right? You might have kids of multiple ages in your own household, and the needs, of a toddler or preschooler is going to be very different, right, than the needs of a kid that's in elementary school versus, a teenager or even a young adult. And so at different ages, you might have different goals for the summer. You might have different activities and routines. And so one of the things to start thinking about is how those activities and routines might support different members of the family. I work a lot with teenagers, and one of the things that I know, teenagers have said when we're talking about activities, for example, is they'll say, well, there's always a lot more stuff for the younger kids. You go to the library and there's lots of library, free activities for little kids, but there's not a lot for teenagers. And so that's different in different parts, of the country and different cities and different towns and places. But I think it's generally true, right, that we have a better sense of what to do for younger kids and for older kids, right, because younger kids might be a little bit more geared towards doing these sort of structured day-to-day activities like camps and things like that. And so thinking about how you can meet the needs of all of the different ages and maybe do some things that are fun for the younger kids, but also things that are fun for the older kids is part of the challenge, but also part of what to think about when planning the summer. And for teens, one important thing that really comes up a lot in the summer, although it's important during the school year too, is that their sleep is different than the sleep kind of habits of younger kids or of adults. There's actually, this natural biological shift in our body clock, which tells us basically when to sleep. It's what tells us when to get sleepy and when to start waking up. And there's this natural shift that happens during puberty. And so as kids become teenagers, their bedtime and their wake time actually shifts about 2 hours later than what they had before. And so for teens, that really means a later bedtime and a later wake up time. So, we're thinking often ideally 11 p.m., bedtime and an 8 a.m. wake time, maybe, although again, this can really vary by individual. But the important thing is to know that, this is why teenagers sleep in. This is why there's now a lot of movement towards the idea that school should start later, because really, they are just not sleeping as well if they don't get to follow this kind of natural rhythm of going to bed a bit later, waking up a bit later. And so, this is going to vary based on family responsibilities, for example, and other things. There might be some challenges to this waking up later, but even thinking about that slightly later wake up time of, 8 a.m., 9 a.m., if it's possible, can be really helpful for teens. But a big part of the reason why we bring this up, even though things might vary for your family, is just knowing again that this is biological, it's natural. And so when you have, teenagers that are saying they're tired, or when you notice that they're sleeping in later, it's not because, they're lazy or because there's any kind of negative kind of thing associated with it. It's just because this is what their body's telling them to do. But we do still want to make sure that teens get enough sleep. We're thinking 9 to 9.5 hours of sleep a night. We are really thinking about sleep times that are fairly similar in some ways to younger kids, just at a slightly different time. And it's important for teenagers. It supports their developing brain. It keeps them alert. It helps, keep your mood, kind of stable and positive. And also, losing too much sleep can really start to cause some challenges, with making decisions and things like that. And so there's a lot of negatives to not enough sleep and a lot of positives to getting sleep. But routine is really what supports sleep, so when you're having sleep problems, that's one of the first things, is really thinking about that sleep hygiene of getting to bed at around the same time every night and waking up at around the same time every day. So, what are some ways, to support youth during the summer? So, establishing routines, again, doesn't mean having, a completely structured day where you're telling people what they do, at 9 a.m. and at 9:30 and at 10 a.m., right? It really means having kind of an idea of what that flow of the day is going to be. What's that kind of daily plan? Whether it's, if they're in a summer program, then there's kind of the daily plan of what they do when they go there, when they come home, and what are those tasks and activities that happen at home. So are there chores, are there particular activities or during the day? With younger kids, it might be an idea of, there might be some time outside, there might be some time indoors doing creative activities, but that they have an idea of what they're doing each day, and this kind of the similar way that they do at school, that meals are around the same time, that kind of thing. You can support youth by really encouraging them to engage with their hobbies. Summer is a nice time to explore new activities, but sometimes kids might need a little bit more support to be able to do that. So exploring new interests, that are mentally stimulating or physically stimulating. If you have kids that really love to be outdoors and love to be physically active, providing those opportunities. If you have kids that like to read or that might be interested, in drawing or in art, finding ways to encourage them to pursue that or setting aside time in the day to do that. Supporting, opportunities for social interaction. So with younger kids, that might mean play dates. With older kids, it might mean finding ways, that they're able to get to and connect with their friends. It can mean camps, sports camps, other kinds of camps, community events. So attending community events together as a family. Volunteering is another great option for kids to both have a meaningful experience, but also get to meet new people and interact with them. And certainly visiting family. One of the nice things about having the time in the summer is that kids can spend more time maybe with family members that they haven't spent as much time with during the school year. And so that can be built into the time that they have. And then we'll talk more about screen time, but really setting limits on screen time as a strategy, to help support these positive routines, to help support a range of activities, in any given kind of week or month. Now, as mentioned, it's going to be different for those younger kids. I think you'll see this on both the slides, both younger and older kids. Starting the day off with sunshine helps to regulate the body's biological clock. So again, that's just kind of a way to start the day, whether that's going outside or being in a part of the house that's sort of near, a sunny window. That can be a way to kind of get the day started and set that clock to, to waking up and being alert at that time. Identifying opportunities for summer camps and activities is something that we very much encourage, and we'll provide some resources for that. And then, as noted, establishing that schedule that provides routine, but with some flexibility. And so maybe there's been some activities that they've decided they like, and there's sort of choosing which of these activities will be the focus, this afternoon. Or maybe they have chores that they should be doing in the house, but maybe there's some flexibility. Do you want to do these in the morning before you get onto other activities, or do you want to do it later in the afternoon when you're done? So figuring out some ways that kids can also be involved in kind of setting their schedule can also provide them with a sense of sort of independence and of, some participation in how they plan their day. Keeping those regular bedtimes and wake times and setting the screen time limits. But really, it can be easy to get into these fights and conflicts around things like how much time you spend gaming or on social media. And so replacing screen time with other activities is often more effective. So instead of just saying, well, you can't do this anymore, it can just be, you'll get to do this until, 11 a.m. and then we're going to transition into some outdoor time. And so you have that knowledge ahead of time of what's going to happen, and that routine becomes what you do each day. And you provide some alternatives to the screen time so that they get to do things, but in moderation. So for teens, similarly, we're recommending, starting the day off with sunshine when possible. Ideally for teens, at minimum for screen time, removing phones and other screens from the room during the time they're supposed to be sleeping can be effective because, it is very hard to sort of switch off this, kind of habit of checking the phone. If somebody texts you late at night, if you're looking into something, it's very easy to pick up the phone if it's right there, for example, or to start scrolling and reading something and continuing on with that. So having a rule that's, for example, you have to charge your phone in another room and just kind of leave it there at a certain point in the night can be one strategy to, again, get away from that sort of daily conflict and more just have some routines around when the phone is in use and when it's not. And that can really support, ideally, some better sleep, because we do know that phones often can be a source of disruption for teens' sleep. Another piece is really to work with teens to decide on what their preferred schedule is, because again, this is a little bit different than younger kids. They're developing, they have more specific, possibly ideas about how they're going to spend their time. They might be developing some more independence on how they spend their time. And so getting to agree together to think about what are the things that they would like to be doing, what are the things that they have responsibilities to be doing for their family or with their family, and how can we work together to get that plan in place so that everyone is part of the conversation. And again, that doesn't mean that you as a parent don't have your particular expectations and goals. Those can absolutely be an important part. There might be non-negotiables in that schedule, but that they're still part of, where there is some flexibility and some room to decide on how they might be spending their time or what kinds of activities they pursue. And part of that is also because, of course, if you have a child that loves sports and is very into sports, that's going to be a very different experience for them to choose to go to sort of a sports focused camp than a kid that, absolutely hates it and can't stand to be there, right? You might find some other ways for them to be physically active, but you want to work with them on what's going to be the best choice for everyone. And then make family expectations clear. If kids have responsibilities over the summer for caregiving or for doing certain things around the house, or there's expectations that they'll be up, and about at a certain time, it's just important for those things to be clear and to be clear ahead of time. The same is true with, expectations. Maybe there's a plan to visit family and maybe you have one child that loves to be out and about and one that really prefers to be at home, but making it clear that this is what we're going to do. This is why this is important to our family, is going to be something that's important from the beginning. And then when it's possible to provide options, like we talked about with the chores, maybe it's the time of day as the option and not the activity. That can also be a way to help everyone feel sort of more part of the discussion and the solution. So technology use, we have here meeting them in the middle as one strategy. This is going to be different for everybody and for every family. And some families may have very strict, rules about no technology use at all. Some might have more, availability of technology use. I think what we want to highlight is that there's not one right answer because it's not all good or all bad. Technology use does provide entertainment. It facilitates connection with friends. Sometimes it facilitates connection to sort of communities around particular topics that maybe you don't have people in your daily life, that are interested in a particular hobby or a particular topic, and you can find that through media. And there are so many different kinds of technology that serve different purposes at this point. And so what somebody gains from playing video games, for example, might be very different than what someone gains from watching movies or TV, engaging in social media, watching YouTube videos. So, so kids might be, doing some or all of these things. You might have, feelings and rules about, these different things. But the important thing is, thinking about that point of moderation, about how to balance this with other activities, and really thinking through what's important to you and what's important to your child. So if it's important to you that they spend time with their family rather than being, playing, being on their phone, then there might be rules around phone use, when you're out, with the full family versus phone use, maybe when you're on your own. But if it's important to you that they don't use screens at all, then that's a different conversation. And then also what's important to your child, what are they gaining from it? Are they gamers and it's really important to them to be able to play a certain amount every day? Is it important to them to stay in touch with friends through social media? So opening up those conversations can be important. So these are all, we've talked about different strategies for just what's common, what commonly comes up for many kids. But there are some kids that might need more support during the summer. There might be ways in which they start struggling a little bit more with their well-being or with their mental health. And some signs of that, these are not true for everyone, but some things to kind of look out for. Kids that withdraw from friends and family, right, that don't want to be talking to friends that they used to enjoy talking to, or that start to withdraw from, connecting with family members that they previously enjoyed connecting with. Or that have a lack of interest in things that they really liked before. So if you have a child that typically loves to go outdoors and play sports, and now they say they don't want to do that anymore, or a child that loves to play video games, and now they're telling you all the games are boring and they don't like them anymore, you start to worry about that, that lack of interest or that sense that they're not really enjoying anything. That can be a little bit more of a sign of maybe feeling a little sadder than usual or feeling a bit depressed. Increase, in any, kind of sadness, worries, or anger. But again, these are normal human emotions. So it's not about having these emotions, but more about when they're somewhat persistent, when it starts to feel like they're sad multiple days in a row, over a period of time, or they're getting very worried a lot of the time about things that didn't used to worry them, or a kid that is feeling a lot of anger a lot of the time. Especially if they're having kind of an outburst of feeling very panicky or feeling very angry, where it feels like their emotions have sort of run out of their control. And that's happening, often. That can be a concern. Certainly noticing substance use or signs of substance use. And persistent changes in sleep or appetite. So not just a little bit of oversleeping here or there, but now that they're really having trouble either waking up, when they normally used to, or they're having a lot of trouble with falling asleep, trouble with nightmares. And the same with eating. Sometimes it's eating too much or eating too little. But the most important thing is just that children's personalities are different. Kids are on, just like adults, we're on a big spectrum of what's our sort of typical behavior, what kinds of things do we enjoy or not enjoy. So what you want to look for is changes in their usual behavior or mood. So again, a kid that's normally pretty shy, that needs a lot of time to recover from seeing people, that really prefers to just have one or two close friends, that can be just a typical personality. And so if it's not a change from how they usually are, then that's not something to worry about. But if you've got a child that's very outgoing, that's normally loves to be around people and be out and about, and all of a sudden they say they don't want to go anywhere, they want to be in their room, now you're going to be a little bit more worried. So what you're really looking for is that change, and knowing that, you as a parent know them best. And if you're wondering, maybe you're not sure, you might ask a few other people that also know your child well. Maybe you're asking another parent or caregiver or person that's close to your family for what they think. And then finally, we want to mention seasonal affective disorder. This is something that people often think about happening in the winter, that there can be this sort of seasonal pattern where you start to feel depressed during the winter months. And we really associate it with winter, with that sort of lack of light, with that sense, it's cold, where there's sort of a real change in routine, and where people can fall into not just a change in mood, but a more persistent pattern of sadness and depression. But it's actually true that for some people, a small number, seasonal affective disorder can happen in the summer, because it's still a change in the routine. There's still a change in the environment that can somewhat trigger that. And so it's not, as common, but again, just something to be aware of, that any of these changes, or, it's good to talk to someone that you feel comfortable sharing this with, whether that might be a primary care doctor or another mental health provider, maybe somebody, at the school, or somebody connected with one of the programs that we'll be talking about here. And so then we do want to think about, as in closing, is really thinking about the plan. What's the plan for your family? You want to plan for transitions. There's all these transitions that happen from the end of school days, and that sort of like big push at the end of the school year, to those, early days of summer that are much more unstructured and where there's a lot of excitement about going forward. Summer activities, as we mentioned, changes in routine can sometimes be week to week. And so there's transitions that take place there. Unexpected changes in plan can be a transition. If a child's really been looking forward to something, maybe seeing somebody that they wanted to see or doing some sort of activity, but then someone gets sick, or the activity doesn't work out because it got canceled, managing that disappointment can be a challenging transition. And then from summer to the new school year, we really want to be thinking in those last weeks of summer, how do we enjoy that time, but start transitioning kids in? If they've had a really different sleep routine, now's the time to start gradually getting them back on that school year schedule. If they've really been sort of in unstructured time, might introduce a little bit more structure so that it's not as abrupt, at the beginning of the school year, and getting them involved in and excited for planning, for that new school year. And so it can be overwhelming, like anything. And sometimes one of the reasons we get stressed in the summer is because we just try to do too much or we have too many expectations. So what I'm suggesting starting with is just thinking about your family values. You know, not all of them necessarily, right? But just a few of the key values for you that are most important to you for the summer. And maybe thinking about, you know, whether your kids have the same expectations or they have different ones. So a couple of examples are that you just might really value most of all in the summer connecting with your family, or it might be staying active outdoors, connecting with culture, having new experiences, or maybe it's contributing to household responsibilities. Maybe there's a lot that happens, you know, in your household or in your community in the summer that's important to contribute to and be part of. So thinking about what those values are, does everyone agree, or do people have very different expectations? And if so, how can you balance? How can you balance that? And then in addition to values, what do you need to do? Work and household, you know, responsibilities, caretaking responsibilities, accessing support, you know, for education or for mental health and social needs. So once you've got kind of that picture of what are some of the things that are most important to you and what are some of the things you need to do and fit together, it suggests creating an action plan that just prioritizes two goals. So not thinking about every last thing that you have to do or want to do over the summer, but what are maybe, you know, two things within these different well-being domains, the social, the physical, mental and emotional, and spiritual health and well-being. What are two that would be your main goals for the summer that, you know, at the end of the summer, you want to look back on and say, okay, I've done these two things, or I've done a few things in these two areas. So again, there might be lots of things you want to do, but if you pick two, that helps identify what's most important. And as plans change or as things get to be a little stressful, you still know that you're sticking to these kind of main priorities for your family. And so from here, I will stop actually, I'll continue to advance the slides, but I think the team will want to share what are some of the resources in the community as well to support some of this.
Yeah, thank you, Dr. Alvarez. Yeah, so this process is definitely, you know, kind of a trial and error. It really changes with, you know, the progression of like your life and like certain situations that your family face. And like what our team wanted to do is kind of like provide you with some resources that you can choose from to help facilitate this planning of like how to, you know, really address like health and wellness within your household. And so first off, we want to touch on, you know, like volunteering. How do we kind of get at like this meaningful experience, especially within like the rural area of Chinle and like central agency? And so a couple of organizations, there is the Chinle Planting Hope. And so with this organization, this provides a multitude of volunteer opportunities for both adults and youth. One of them is having a mobile library that people can help out with, as well as a thrift store, a bike shop, and they even like help start these small gardens. For this year, they're doing a smaller than usual garden because they're planning on moving into a new building next year. But you know, that is something to keep in mind if you want to like kind of go outdoors a little more and like kind of be um involved in activities with like, you know, outside and gardening and such. So with this, we recommend calling these two numbers. The first number, that is like the general number for the organization, and you would typically ask for Janice. But if you can't get through, then we recommend using the second number below. Um, and a thing to note about this organization is that they do offer this opportunity to get a certificate after obtaining a certain number of volunteering hours. And so our next organization is the Chinle Office of Dene Youth. ODY, essentially, that's their acronym. And so ODY is like they offer a number of like opportunities and activities for youth in the community. And I would just recommend, you know, giving them a call about how to like, you know, volunteer for some of them. Examples of like what they do. They sometimes do movie nights. community cleanups, educational presentations, traditional knowledge sessions, recreation activities, and cultural awareness, and just so many more. But I would recommend calling them as well. And then there is Canyon de Chelly. If you go to their office, they typically have opportunities for high school and college youth for to volunteer as campground hosts, maintenance helpers, and information assistants, as well as other positions. But you can inquire with them through this phone number as well. And then there's the Mini Farms Boys and Girls Club. Similar to the Office of Dene Youth, they offer a number of opportunities, and you can really like get out there if you call their number and vocalize your want to like really help out in this capacity. And then lastly, we have the St. Mary's Food Bank, and they typically help with food distribution, and they're part of a broader organization within Arizona, but they have some headquarters in Chinle, so you can give this number a call as well. And one thing to note about some of these opportunities is to inquire about the process of having to obtain a clearance card, which is basically a background check. It doesn't take too long, but if this is something, volunteering is something that you want to be, that's on your radar, I recommend really like seeking out guidance on how to go through this process. And I do think it'd be very fulfilling to do so. So can you go on to the next slide? And so this brings us to community events. So PAWS and just Johns Hopkins in general, within the Chinle area, we're hosting 2 events this upcoming summer. The first is a Color Fun Run, which will be taking place on June 11th. It's both of these events are free, and for the Color Fun Run, it involves a 5K run and then a 2-mile walk, and both of them start at 6 p.m. And the location of it is the Chinle Chapter House. And t-shirts will be available for the first 350 to register. And with that, we have other resources like the Mental Health Resource Fair that will take place before the color run. So just be sure to check that out if you have the chance. The next one is our Native Vision that is in partnership with Visual Horizons. This is a summer camp for youth K through 12. It's a sports camp and a life skills camp that really just help your child and youth kind of reflect on what wellness can look like for them. And this is going to be held at both the Chinle High School and the junior high school, and it will be held from July 14th through the 17th. As you can see, the available sports that they will be offering include lacrosse, basketball, volleyball, disc golf, and arts and crafts. So we have this little pop-up here in case watchers or participants want to like scan that to register. Again, it's a free event and it's a multi-day event. So just be sure to check that out with this Native Vision event. Collegiate and professional athletes will also be contributing their time to help teach youth how to foster skills within each of these sports and activities as well. So that's a good thing to note. Next slide. And these are the community resources that our team has gathered, and I'll give this to Cody and Ty to talk a little bit more about.
Cool. Yeah, thank you. So coming into this one, after you do scan our QR code, it will take you to a Word document that has a list of all of the resources that we have found within Central Agency, along with Navajo Nation as well. To name a few, in the Chinle area, we have the Comprehensive Healthcare Facility. We have our IHS Counseling Service, our IHS Native Medicine, and then our Amato Achinabagan. And then going to the Navajo Nation. So in there we have the Navajo Nation Division of Behavioral Health and Mental Services, the Navajo Nation Division for Children and Family Services, along with the Veterans Administration, the Judicial Branch, and the Human Rights Commission. Addition to these, we've also found traditional services. So one of them that we found was Winslow Indian Health Care Center. Here they have the Navajo Traditional Medicine Program, and the program uses the Navajo Traditional Dana Healing Services to address the patient's spiritual health and wellness. Their concept is off of the Hajongo Doke, and it really helps to restore the balance and harmony with patients. So in there, you'll find their phone number along with their link to their website. Addition to this one, we also found the Dine Hatathi Association. So this one is more of an organization that preserves and protects all of the Dine traditional ceremonies. That includes the songs, the prayers, and the ceremonial processes and the sacred sites within Navajo Nation. This one, if you do go through this one, it's kind of like a step-by-step process where you will get in contact with the organization, and from there they will set you up with a certified hatathi within the services of needing a hatathi, needing an herbalist, needing a dietetics technician, a traditional counselor, a peacemaker, and apprenticeship as well.
And yeah, so there's also not only those resources, but there's also crisis lines. There's suicide and crisis lifelines, crisis text lines, veterans, also for child abuse and neglect, domestic violence and sexual assault. There's also crisis lines for the LGBTQ+, and there's also one that I would like to highlight, which is the Strong Hearts Native Helpline. It is a 24-hour safe and confidential anonymous domestic dating and sexual violence hotline for American Indians and Alaskan Natives that offers support and referrals and advocacy. And there's also their Native telehealth, the IHS Johnson Vision Network. Underneath that, the program is to provide and promote support and delivery of high quality for Native Americans.
So yeah, and that sort of brings us to our concluding remarks, as well as just want to say ahiahat for all of our viewers and our attendees. And if anyone has any questions, feel free to ask, and we'll be willing to answer.